It's one of these diseases that is difficult to define it by a single test, and it's need a multi-factorial or multi-element analysis to be able to reach the diagnosis, including patient's symptoms, biochemical tests like PSA, family history, and then examination using an MRI scanner, and finally a biopsy. All these factors can help to define if a patient has a cancer, what level, and where does a treatment needed or not. In most cases, the prostate cancer diagnosed at quite early stage, and majority of patients are asymptomatic. But for those who are unfortunate to have a late diagnosis, most of them will have symptoms either of waterwork symptoms or symptoms related to advanced disease like tiredness, lethargy, and weight loss. It's a multifactorial aspect, again, with the treatment depending on the stage and the grade of disease, i.e. where it has involved. Is it within the prostate or outside the prostate? For each part of that, there is a different treatment protocol, which will be kind of tailored to the patient clinical need and clinical stage. Treating prostate cancer depends on a number of factors like the patient general well-being, the level and the extent of the disease, the ability of the patient to have aggressive treatment or less aggressive treatment, and all these factors define what is the most effective way to treat this in particular patient. Prostate surgery has become a very common procedure done now, robotic assisted as a keyhole, length of stay about 2 to 3 days, with a catheter for a week or 10 days, and patients can resume more or less normal activities within 3 to 4 weeks, putting more care to not put a lot of pressure on the pelvic region, and most of the activities will be back by 3 months. I think the answer to this question depends on the stage and level of the disease. For those who have early stage, and in latest study done in the UK, there's 99% survival rate for those who have localized prostate cancer of low grade, but that differs according to the stage and the level of disease in the later stages. It depends on what type of treatment modality the patient has had. In some modalities like active surveillance, where there is no clear treatment, it's just a monitoring, that should not impact the quality of life. Lots of minimal invasive techniques that applied like focal therapy and or even robotic assisted has less impact on the quality of life of patients, with some more of treatment, pre-treatment training and utilization of medicine. In some cases, they can maintain good or great deal of their quality of life. It remains that for those who have a high stage or high grade or advanced disease, different impact can happen, which can be modified and or helped through the right channels.